Thank you for joining. I've got a few more people coming in for sure. I appreciate you guys coming into this kind of group consultation. There's a lot changing as far as the marketplace goes. As you guys know, the government's in a shutdown right now, and a lot of that is due to the enhanced premium tax credits that people were receiving to lower the cost of their insurance since COVID. The last administration, whenever they passed the American Rescue Plan Act, added a bunch of additional tax credits to lower the cost of insurance for many different people. People even with higher incomes were getting tax credits that weren't getting them before. People who had certain immigration statuses that weren't eligible before were getting these tax credits, and now it looks like all of that's going to be expiring at the end of this year. So the pricing we're going to see when we look at options for 2026 is going to be firm pricing unless they somehow end up coming to an agreement and decide to add those enhanced premium tax credits back. So what we're looking at now will be the price. Let me go ahead and admit one more person here. Hello, how's it going?
I'm good. How are you?
Doing good. Thank you so much for joining. I was just telling everyone here that there's been a lot of changes, and we're going to see some prices go up for some people. For some people, it's not going to be that big of a difference. But with me having, several hundred clients, and also with me working on many other big things like group insurance policies at this time of year, it is helpful to try to help a bunch of people at the same time. It's harder for me nowadays more than ever to do one-on-one. So I appreciate you guys joining this weekly webinar. I will be doing these weekly, and just so you guys know, I'm going to also be recording this. So everyone who's here, please do not give any personal identifying information or health information. Protect yourself. Just if you want to just kind of sit here and listen, I think that would be helpful. I'm usually pretty good at answering questions before they're even asked. But if anybody does have any questions, you can feel free to chime in. Right now, we don't have too many people in this meeting, so if somebody just wants to unmute their mic and say something at any time, they can. Just be careful what you say. I don't want you to say anything to identify yourself. Although I have lots of good, trustworthy clients, I just wanted to go ahead and mention that. Now, I'm going to go ahead and share my screen. Let me get started here. I think we might have a few more people join. Like I said, I'm going to be recording this so they can catch the beginning in the recording. So, as you guys know, and we've already talked, all of us have talked at some point one-on-one, but the individual marketplace is the only place that you can go to get a health plan that will cover pre-existing health conditions day one, no questions asked. These plans are comparable to what you could get through your employer. If you had an employer group health plan, or if you had insurance through the military, or if you worked for the federal government, or if you were getting insurance because of your low income or something like that through the state, like Medicaid or Children's Health Insurance Program. This insurance covers you day one, no questions asked as far as pre-existing conditions go. So really, there's no health questions asked when you're doing the application, which makes it very easy, and it makes it easy for me to present these plans to my clients because I know they will cover you. And I know that there will never be an issue where they're like, well, I was expecting this to be covered and it wasn't. They will cover you. Even if you needed surgery on day one, this insurance would pay for it. These insurance plans also cover preventative care screenings and immunizations at no charge. So you will see when you go into the plan details that there are many different preventative care services that you can get for free. So all of your wellness visits, cancer screenings, diabetes screenings, depression screenings, everything preventative care wise is completely covered 100%. It's free. Okay, and there's a ton of different preventative care services. Here's a breakdown for women. Here's a breakdown for children of all those services that are free. Okay, the other thing about these plans, all of them come with an out-of-pocket maximum. As of right now, if you're on the insurance currently, your out-of-pocket maximum might be as high as $9,200. This number right here is the kind of most important number and main reason to have insurance. This is where they stop your losses. So if you are in the hospital for a number of days or weeks or months, and you end up racking up millions of dollars in medical bills, the most you should be billed by the hospital and the doctors and the pharmacies is $9,200, depending on what your out-of-pocket maximum is on your current plan. Okay, but in 2026, the out-of-pocket maximum is going to go up. Okay, so it is going up to $10,600. This is still a fairly low out-of-pocket maximum when you consider how expensive medical bills can get. And this number is very important, and there are some plans available that have a lower out-of-pocket maximum. It's likely that they're going to be more expensive, but as you can see here, for an individual, just as an example, from Dallas, who's 35 years old with a $40,000 income estimate, this person would still qualify for $352 per month to lower the cost of their insurance. And that's a tax credit from the federal government. That's the standard tax credit that you would have gotten, just the same way it's always been. With the enhanced premium tax credits that they started back whenever they passed the American Rescue Plan Act, this number would have been higher. But this is still a good amount. And as you can see, you can get a very valuable plan. Even this lowest cost option here has unlimited coverage and protects you to an unlimited amount once you reach your out-of-pocket maximum. And it pays for preventative care, and you have coverage that covers your pre-existing conditions. So I just want to make sure that's clear. Even though this plan is normally $414 a month, which is a pretty expensive plan, if your income is in a certain range, you may qualify for enough tax credits to make this plan fairly affordable. Okay, I want to see if I can share something in the chat real quick for all of you. So if you want, you can follow along and do your own quote. Okay, also, if you worked with me in the past, you probably were enrolled through healthsherpa.com. That's the website that I use. It's completely synchronized with the health insurance marketplace, and you can go there and log in and see what you're enrolled in now. And you can start the renewal process to where you can update your application and then view all of the plans available for 2026. But I'm going to go ahead and add to the chat here the link in case you don't know where to find it. You can go to my website, victorinsuresyou.com, and you can select check your eligibility under the individuals and families tab, and it'll take you to the same link here, the same website. But once you get in, you're going to see, depending on your zip code, you're going to see that there's several different plans to choose from. And I just want to reiterate, I know I've probably told you all this in the past, but these are not government-ran insurance companies. These are privately owned and publicly owned companies. Okay, the only thing is they are participating in the federally facilitated marketplace, which means they have to follow all the rules of the Affordable Care Act. They have to cover pre-existing conditions, cover you to an unlimited amount, pay for your preventative care. Those types of things are all, requirements of the Affordable Care Act. And they also have to take these tax credits from the federal government to lower the cost of their plans if you're eligible for it. So this is the only place you can go to get health insurance that is comparable to what you would get through an employer. And the only place you can probably get it this cheap because of these tax credits if you're eligible. Okay, I'm going to see if I can share one more thing to the chat before I share my other screen. Just give me a second. Oops. One sec. I think you should be able to click on this link. And when you get there, you will see the federal poverty level chart. Okay, let me go ahead and switch this sharing over to this chart. This is just to give you guys an idea of how this all works. So if you're an individual making between $15,650 and $62,600, you're likely eligible for tax credits to lower the cost of your insurance. If your income is between 100 and 150% of the federal poverty level, then you are eligible for enough tax credits to make your health insurance completely free. And I will show you that here in a moment. But as you can see, oh, I'm going to let someone else in here. Just one sec. Anyways, as you can see, it works the same way if you have several people in your household. So if you're an individual with some kids, with one kid, and your income is between 100 and 150%, you're going to be eligible for free health insurance. You're also going to be eligible for the highest level of cost sharing reductions, and that's where they lower your out-of-pocket expenses on silver level plans. So just to give you an example, I'm going to put in an income kind of right in between, and I'm going to pull this screen back up, so don't worry. If you have an income between 100 and 150% of the federal poverty level, you're going to qualify for a lot of tax credits. You're also going to be eligible for cost sharing reductions. And just remember, these tax credits are different for every zip code. So if you're not in this zip code, you're not going to get the same amount of tax credits. But you will be eligible for the same level of cost sharing reductions, and that's where they lower your out-of-pocket expenses on silver level plans by up to 94%. So although the silver level plans are not free, you will see that the out-of-pocket expenses on these plans, if your income is within that range, are extremely low. And that's exactly why silver plans are more expensive than gold options. Because at one point, the insurance companies realized, okay, if we're going to have to lower the out-of-pocket expenses on our silver plans, well, we're just going to charge more for our silver plans than our gold options. So that's why you see a bunch of gold plans here for free. But I highly suggest, even if your income is fairly very low and you can barely afford to pay for a premium, if you have health problems, you should probably go with a silver plan because, like I said, these out-of-pocket expenses are reduced tremendously. Instead of a $10,000 out-of-pocket maximum, you'll be covered after you meet a $2,200 out-of-pocket maximum on this plan. And look, this one's got a $1,500 out-of-pocket max. So these plans stop your losses at a much lower amount than the gold plans do. And the gold plans, yes, they are free and they are good. But when you go to a gold plan, you're hopefully going to find one that your doctors accept. You're gonna look for a lower deductible and better co-pays. Okay, just so you guys know, you can add your doctor right here to the left under the filters. You can add your doctor and even add them as a filter. So we'll just put in a popular doctor name. I'll show you real quick what this looks like when you add a doctor. Okay, so we're going to put in this family medicine doctor, hit done, and then you're going to see right below whether or not the doctor takes this plan. Okay, and you can actually select the filter so that you only see plans that your doctor accepts. Although if you do that, then you're really narrowing down your options. And I just want to make it clear to everyone, it's up to your doctor what they accept. And if they're not willing to accept a plan that's affordable to you, then you really just should know that every one of these insurance companies do have providers to back up their network. Okay, they're all a little bit different, and I do have companies that I think are better than others. But let's go ahead, and I'm going to put in a more realistic income estimate in here. Okay, let's just say somebody has somewhere around a $35,000 income. Okay, look, the lowest cost gold plan at this point is $141 a month for this person from Dallas. And that's after a $421 a month discount or tax credit, right? And although this person is still eligible for cost sharing reductions, it's not enough to make you want to spend the extra money on a silver plan. Because the silver plans are a lot more expensive. Silver plans are a lot more expensive, and the out-of-pocket expenses at this point really are not really any better than the gold plans. Yeah, they do have a slightly lower out-of-pocket maximum than the gold plans, but this deductible is higher than most of the gold plan deductibles. So, unless your income is very low and between 100 and 150% of the federal poverty level, then I would suggest you look at gold plans. Now, all that being said, again, you can choose any one of these plans, even the lowest cost bronze plans that are free, or in some cases free, have a lot of value and will cover you to an unlimited amount and pay for preventative care, screenings, and immunizations. I do want to mention that, if you are really trying to make a decision based on the plan itself, and you want something that is going to really feel like substantial coverage if you go to if you end up having to go to the doctor or to the hospital or the emergency room, you definitely would be happier with a gold plan. Okay, because the gold plans do have lower deductibles. Now let's look at one decent gold plan, and we'll kind of dive into it so you understand how each one of these plans work. They all work pretty much the same way. Okay, so like this plan right here. And by the way, Baylor Scott & White is a great company if they're available in your zip code. I love Baylor Scott & White. I haven't heard any complaints from any of my Baylor Scott & White clients, and I have more Baylor Scott & White clients than any other. And the reason why is because they've had some of the best plans, the best prices for a couple years now. They're pretty stable as far as their benefits go, as far as their coverage goes. Now, if you go to the hospital with this plan, as you can see here, the emergency room is full price until the deductible is met. And on this plan, the deductible is $1,500. So if you're in the emergency room, they're going to bill you that first $1,500, and they're just going to bill you. Sure, they might try to ask you for that money right then and there in the emergency room, but it's not required that you pay it before you leave. And they're not going to make you try to pay it before they sew your finger back on or anything like that. It's an emergency. Not everybody's prepared to pay their deductible, and they know that. Okay, they will bill you though the first $1,500 of that emergency room visit, and then after that, with this plan, if you go to the emergency room again, they're going to charge you $750 the next visit for that copay. Okay, now if you're in the emergency room and then you're admitted into the hospital, well, your deductible will have already been met, and really that whole hospital stay, whatever it costs, will be covered at 70%. That's with this plan. It's not the same with every plan, but with this plan, you'd be covered at 70% if you're admitted into the hospital. Okay, and if you're going to need a surgery while you're in there, that doctor would also be covered at 70%. Okay, but just remember, this deductible counts towards this out-of-pocket maximum. So once you've been billed the deductible, you're already $1,500 into this out-of-pocket maximum. And if you're getting charged 30% of whatever is left over, it's going to take a good amount of medical bills for you to actually meet this out-of-pocket maximum. Okay, and that's why, you know, a plan with a deductible and a high level of co-insurance is typically better than a plan with a $0 deductible that only covers you at 50%. And I'm going to show you an example of that too. Okay, so look, I'm going to try to find, I know there's a plan here from United Healthcare. Let's see. Well, here's one from Oscar with a $0 deductible. Let's take a look at the plan details. So this one actually is it's somewhat of a simple plan because the deductible is already met. That means you know that you're already covered, for example, at 50% for the ambulance. Okay, but one reason why you may not want a $0 deductible plan is because a lot of times it's kind of like a trick. As you can see here, they charge $3,000 per day if you are admitted in the hospital. That's basically full price. So although your deductible is met, you're still paying full price for the hospital stay. And all it would take is, what, 2-3 days for you then to meet your out-of-pocket maximum, right? So, you know, all it would take if you have, for example, a $10,000 out-of-pocket maximum is basically 3.5 days in the hospital, or, you know, an emergency room copay, and then, you know, a couple days in the hospital. It's not really great to have a $0 deductible unless, you know, you're covered at a good high percentage, which you're not going to find. You're not going to find a $0 deductible plan that covers you at a high percentage. You're going to see either like 50% coverage, or you're going to see something like that where they give you copays that are basically full price. Okay, now if you do want the lowest cost plan with a $0 deductible, that was a good option. And it's, I mean, all of this is really good insurance to have. But now let's go back and look at a quick gold plan and do the same scenario. Okay, let's just say you have, I'm going to go ahead and show you one of my favorite looking plans. So you have the Baylor Scott and White Elite Gold plan with a $500 deductible, right? Well, this plan, once your deductible is met, and if you're in the hospital, you're covered at 75%. Okay, so that means that, you know, you're only paying 25% of what's left over after your deductible is met. Well, that means you're going to need almost a $40,000 medical bill to ever meet this out-of-pocket maximum, right? So if you had one of those plans that I was looking at earlier, one of these bronze plans that has a high deductible, all it would take, for example, with this plan here, is a $9,200 medical bill for you to meet your out-of-pocket maximum, because nothing is covered until the deductible is met. Now, not all bronze plans are the same. This bronze plan right here, that's a gold plan, sorry. Do I have any other filters that are preventing me? Hold on one sec. Yeah, so look, this bronze plan right here and this one, they have copays for some things, like your standard doctor's visits. This one even has a copay for specialist. These both have copays for generic drugs. But when you're looking at a plan like this that has everything is no charge after the deductible, what that means is everything is full price until you've spent $8,000. Okay, so, you know, all that being said, I hope everybody understands. If anybody needs clarification or more examples of what I'm talking about, please let me know. But I want to point out one other thing. You guys can go in to any one of these plans. Underneath the plan, you're going to see the 3 blue hyperlinks. If you click the benefits hyperlink, it's going to take you into the summary of benefits and coverage. If you go to page 6 or 7 or 8, sometimes it's page 8, it'll show you exactly what it would cost. Well, it'll show you an estimate of what it will cost for these 3 different standardized sample costs. Okay, every one of the plans has a summary of benefits and coverage, and they all use these same standard standardized cost. Okay, so Peg's having a baby. If Peg has a $12,700 hospital stay because she's having a baby, well, with this plan that I was just showing you guys, it would cost her $9,300. If you've got Joe managing type 2 diabetes, and he's got a $6,000 deductible, and after his deductible is met, he's then covered at 50%. Well, if the sample cost was $5,600 a year, still going to cost Joe about $4,820 with this type of plan. Okay, and then you've got Mia's got a simple fracture. She goes to the hospital and they charge the emergency room and they charge $2,800. Well, she's going to spend $2,810. This is just an example. It's not exact. You don't know exactly what every hospital is going to charge or what every medication costs, but it gives you an idea of how it will be covered. You meet your deductible, you pay, this is what you pay for your specialist, this is what you pay for the hospital. Okay, now just to give another example of that, I'm going to go to the gold plan that I was just showing you guys. The one that I like is the Baylor Scott and White Elite Gold. Now, it's just, I think, a really good plan because of the way the plan is set up, structured. But if you go to the same blue link and go into the summary of benefits and coverage, look, this person who has a $12,700 hospital stay because of having a baby would only pay $3,900 instead of $9,300. Okay, but either way, and they don't show this as an example, if things got extremely expensive and somebody ended up with $1 million in medical bills, with this plan right here, having a $10,600 out-of-pocket maximum, this person would end up being billed $10,600 for that $1 million worth of medical bills. If you go back and you look at that bronze plan we were just looking at before, this person would pay the same amount, $10,600, and they would have paid nothing for their health insurance all year long if they were eligible for enough tax credits to lower the cost of their insurance. Okay, so although you could pay a little bit more to get a little bit more coverage day one for things like doctors and medications and hospital stays and procedures, all of these plans stop your losses once you reach your out-of-pocket maximum, right? So it's just a matter of what you want. If you're more worried about just catastrophic type situations, you'd be covered if you went with the lowest cost plan. Now, all that being said, I can remove this income and really just show you the full price of everything. Right? These are expensive, valuable health insurance plans, and it really depends on what your situation is. But I want to get into that a little bit with everyone. Okay, so when you are putting in your information into your application or you're just trying to get yourself a quote, you need to make sure that if you are single, that's okay. You just put in your age. You don't have to do anything else. But if you have a family, even if the whole family doesn't need health insurance and you're the only one who needs it, if you're claiming dependents on your taxes, let's say, for example, this 35-year-old has a daughter, but her daughter has Medicaid or something like that, you need to put down that there's two people in this tax household, okay, because she's your tax dependent. Okay, if this person is married and let's say that their spouse has health insurance through their employer, but that employer doesn't offer them health insurance, well, they can come to this marketplace and get tax credits, right? So make sure you put in that you've got two people in your house, your tax household, because when you go through and get these tax credits, it's going to be based on your tax household. So who you're filing jointly with or who you have as dependents. Okay, let's say this person is married, their husband has insurance through their employer, and their kid has health insurance through Medicaid, okay, or an ex-spouse. Okay, if you are claiming your kid, you still want to put in that you have 3 people in your tax household, even if you're the only one applying. Okay, now If it's just you, that's fine, okay? But when it comes to your income estimate, remember, it is not based on what you made last year or what you make what you're going to make this year. This is an estimate of your income for 2026. And I know that's difficult to estimate. You know, it's hard to know exactly what you're going to make in 2026. Okay, but just do your best, and don't be too optimistic, and don't be too conservative. Try to be as close as possible. But just remember that this is a live application. Okay, so at any time throughout the year, if your income is looking like it's going to go much higher than what you estimated on this application or much lower, the marketplace encourages you to update your application as you go. In fact, at the end of the application, one of the agreements that you sign says that you do know that if information you listed on this application changes, that you must let the marketplace know within 30 days. Okay, it's not actually a requirement, but it is highly encouraged, because what you don't want to do is say that you're making $21,000 a year, receive $583 a month, for example, and then you end up making $40,000 and reporting that on your taxes. Because that $583 a month is what you were receiving whenever you should have only been receiving $352. So 583 minus 352, that's $231 a month more than what you should be receiving. And that is actually going to have to get paid back to the IRS when you go to do your taxes. Okay, it's not a penalty. There's no interest. If you want a lower income estimate to save money on your health insurance all year long, knowing that you're going to owe some tax credits back at tax time, that's okay. You can do that. But what I don't want is any of my clients to think that they could just punch in a low income estimate and save a bunch of money on health insurance, and there's never going to be any repercussions. Okay, because there's actually one of the things that just recently changed was the repayment cap. Okay, so back in 2020, when Biden passed the American Rescue Plan Act, he put a cap on what the repayment had to be if somebody underestimated their income and received way more tax credits than they were supposed to. The repayment cap was like $1,650. Well, just recently, whenever they passed the One Big Beautiful Bill Act under President Trump, they did away with that cap. So now if you owe $231 for every month because you way underestimated your income on this application, that's $2,700 that you would have to pay back at tax time because you were receiving more tax credits than you're actually eligible for. Okay, so it's very important to be as accurate as possible. All right, as close as you can be, but just remember, you can always update your application throughout the year with a new income estimate. If, let's say, you start suddenly having a good year, you get some big sales or whatever it may be, you get a new job, you definitely can update your application and your income. Okay, another thing that you should know is if you become eligible for coverage through a new job, and that coverage is considered affordable, which they consider basically anything less than 9.96% of your annual income affordable now, which is totally debatable. Just because you make, let's say, $100,000 a year doesn't mean you feel like you can afford $10,000 a year on health insurance. Well, if your employer is offering it to you for less than $10,000 a year, it's considered affordable according to the government, right? So, that would be like if someone made $100,000 a year and their insurance cost them less than $833 a month, that would be considered affordable. Okay, but if you need help with that math, let me know. Ultimately, just keep in mind, if you're eligible for employer-sponsored coverage, and it's considered affordable, you're not eligible for these tax credits. Okay, now that being said, if anybody has any questions about anything I've said, please let me know. Now I just want to kind of go into the differences between these plans. Okay, you have, first of all, in Texas, only 3 different network types. Okay, there are no PPOs available. You can get a PPO through your employer, or if you move up to Oklahoma, you can get a PPO through the individual marketplace. But in Texas, you only have HMO and EPO and POS available. Okay, an HMO is a health maintenance organization. Just to make it easy to understand, it means you're going to be required to have a primary care physician, and that primary doctor is going to have to refer you if you need to see a specialist. You can't just self-refer to specialists. You have to have your PCP refer you, unless it's your OBGYN. Your OBGYN, you can self-refer to. That's the one exception. But that doctor does have to be in the HMO network, okay? EPO is an exclusive provider organization. And what that means is you can go to any doctor in that company's network. You don't have to have a primary care physician refer you to specialists. You don't even have to have a primary care physician. So that gives you a little bit more flexibility, okay? But just like the HMO, in an emergency situation, if you end up going to an emergency room that's not in network with your HMO or your EPO, if you go to a hospital, I should say, that's not in network, you don't have to worry, because no matter where you go, all emergency rooms accept all insurance, okay? The only time you do have to worry is whenever you have a procedure scheduled, or if you need to see a doctor, you need to make sure you go to places and doctors that are in network with your EPO and your HMO. Okay, and then you also have a POS. I won't spend too much time on this because these ones are typically a little bit more expensive anyways. But POS is point of service, and what that means is you can actually go in and out of network. Okay, you see how it says right there, it's a hybrid of a PPO and an HMO. Well, that means you can go out of network. The problem is, if you go out of network with a POS, your coverage never, or your losses never stop. Okay, so you see how you have an out-of-pocket maximum if you're in network. But if you go out of network, let me show you this real quick. If you go out of network, the deductible, first of all, goes from $7,300 to $15,000. And if you go, when it comes to the out-of-pocket maximum, your deductible in network is $10,600, and out of network it's unlimited. So they never stop your losses. So even if you did sign up with a POS, I would still highly encourage you to stay in network, or it's going to cost you a lot of money. Okay, so keep that in mind. Now, there's also differences in these companies. Okay, I'll just be straightforward with you. This is based on client feedback. Okay, I haven't sold a ton of WellPoint plans. I probably sold a dozen or two dozen WellPoint plans, and I haven't heard any complaints. Okay, a lot of times if somebody's doctor's in network with WellPoint and WellPoint's the most affordable option, they'll go with WellPoint. Okay, and better. One thing you should know about them, well, the last thing I should say about WellPoint is they've been in the marketplace in Texas now. This will be their second or third year. Okay, and better is they're the biggest actual individual marketplace insurance company in the nation, which sounds crazy. They're not the biggest in Texas, but in the nation they have more counties than any other insurance company. Blue Cross Blue Shield is the biggest in Texas, okay? But Blue Cross Blue Shield has 2 different networks in Texas. Their My Blue Health network is tiny, okay? And I have heard complaints from clients about the My Blue Health network. Okay, the Blue Advantage network is the big one. This one is actually available in every single county of Texas. In some counties, they're the only insurance company there. So if you want the most access to doctors and hospitals in Texas, Blue Cross Blue Shield's Blue Advantage is it. Okay, Cigna, they're doing good. They've been here now 3-4 years. They're a little bit on the pricier side this year, but you know, Cigna is a good company. They're also a nationwide network. Not to say everywhere you go will accept your Cigna insurance, but you'd have a good chance that they would have a doctor in your area wherever you go in the U.S. if you have Cigna. Imperial Health, this is a company that was a Medicare Advantage company, and they just entered into the under 65 market in the past 2 years. And I haven't sold hardly any of them, and their plans just really haven't been that great. I hate Molina. I don't like Molina. I've heard so many different clients say that they signed up for Molina and they couldn't find a doctor in network. And the doctors that they did find were, you know, low quality clinics and you know, in bad parts of town. Now, I don't know if that's always, I mean, if that's still the case with Molina, but I steer away from Molina for the most part. Really like Oscar. Oscar's good. Oscar also has a EPO network. So that lets you go, like I said, to any doctor you want in the network. You don't have to have a primary care physician. I really like Baylor Scott & White. Like I said before, Baylor Scott & White, I've got more clients with them now than any other company through the marketplace. They've got really good, high quality clinics, hospitals, and doctors. And United Healthcare, everybody knows them. They're the biggest in the nation as far as insurance carriers go. They're not the biggest when it comes to the individual marketplace, but for group insurance and Medicare Advantage, they're huge. And that's pretty much it. Now, as far as all these plans go, I want to mention this. You can go directly into their doctor provider finder by just clicking on the blue hyperlink below the plan. You go straight into their provider finder. You can put in your zip code. Let's just try the Dallas zip code. You can select a specialty if you want to see, let's say, all primary care physicians, or let's say all hospitals, for example. You hit search, and they're going to show you all the hospitals in network in the area. If that's a concern, you can do that for every one of these companies. If you're just picking a plan, you know, based on the network alone, this is a good way to research it. So many great hospitals in network with Baylor Scott & White, including all their own facilities, along with hospitals like Methodist and some others. But there's a lot of Baylor Scott & White hospitals in the Dallas area. And then if you want to look at primary care physicians, you can do the same thing. Just see how many are within a reasonable distance of you. You do that same type of filter, just look for the specialty. And then look, for example, this person has 259 primary care physicians within 9 miles of their zip code. That just doesn't seem right, but that's what it says. Anyways, so that's just a good example of how you can look up the network, okay? Now, all that being said, if this insurance, guys, is becoming unaffordable for you, there are options outside of the marketplace. Okay, I can help you get insurance that is not compliant with the Affordable Care Act. And in some cases, it may be cheaper. For example, let's say you don't make $40,000. Let's say you make $90,000 a year, right? And you're not eligible for any savings at all, okay? And you're looking at plans, the lowest cost option plan being $393 a month, just as an example. Okay, I can find you a bunch of insurance for $393 a month. And you know, you might even like it better than this, considering this plan doesn't cover anything until you meet your deductible, which is 10 grand. It does cover doctor's visits and preventative care visits Okay, and it is good protection. That's almost $400 a month, right? If you don't want to pay $400 a month for insurance that only covers you if you have some major stuff come up, you can look at, I can help you guys look at other options outside of the marketplace that aren't compliant with the Affordable Care Act. The problem is with these plans that are not compliant with the Affordable Care Act is just that they are underwritten, which means they do ask health questions. If they see something that they don't like, they may not approve you. Whenever you're filling out the application, you'll know you'll either be approved or you won't. But they will cover you, and you might even get a price that you think is very reasonable. If this is your situation and you make $90,000 a year and you don't want to pay $400 a month for a plan that doesn't cover anything till the deductible is met, you may want to look at something like this. Let me just show you an example. So this is a new company I'm working with. From what I understand, what I've been told, will actually not investigate any pre-existing conditions unless charges start coming in over $700. And if you do get approved for this insurance, any pre-existing conditions you may have would actually be covered after you have this insurance for a full year. Okay, so this is a good option that pays for a lot of different things. And if you couple this with something like an accident plan or a critical illness plan, you really have a good, well-rounded, well-rounded coverage is what I'm trying to say. And hold on one sec. Let me just show you. If I add kind of, let's do this just as an example. Say $40,000 of critical illness insurance. Look, I mean, we could even add a $3,000 annual maximum benefit dental plan. We'll even add, what do we got here so far? We'll add an accident plan, 24-hour coverage. Okay, look, I'm going to go ahead and show you this real quick. Oops. You're looking at, for health insurance, a plan that will pay you $40,000 if you have a heart attack, cancer, or stroke. Dental insurance and vision insurance and an accident plan for $189 a month. Okay, this insurance, I mean, it's a good option if you're really just looking to have something in place that's not costing you an arm and a leg and does have, some substantial coverage. Let me see if I can open this up in a new window. Hold on one sec. It opened in a new window, but not one that you guys can see. Hold on. There we go. Now this plan right here is an accident plan. It pays you, your beneficiary, if you pass away, $25,000 or $50,000, depending on which unit you pick. Okay. I can send any of you guys, if you're interested in any of this type of stuff, you can get it, but it has basically a benefit for every situation that could come up due to an accident. All right. So just to give you an example, I have an accident plan. My daughter fell or had a friend fall on her foot and she injured her foot, thought the bone in the top of it was broken. I took her into an urgent care visit, which my insurance paid for, my health insurance. It was a $60 copay. They did an x-ray, gave her a boot, and basically told her to rest it. And I placed the claim with my accident insurance, and they sent me $380. for my daughter's foot, which only really cost me $60. Having an accident plan in place is at least a good way to give you a little cash if you're down and out from an injury. Okay, now that's just the accident plan. Now let's look at this plan here. This is an example of what could replace or be an alternative for your health insurance. Open a new tab. So this plan right here, it gives you a first day admission benefit if you are confined to the hospital. It is $2,000 per inpatient day, even if you just have the classic plan, which I just showed you guys. And if you're admitted, you're also going to get a first inpatient day of $1,000 just for the first day that you're admitted. Okay, so this plan it's got set benefits for every situation that comes up, including surgery. If you ended up needing a surgery, this plan will pay. This one right here, the classic, will pay exactly what Medicare pays for a surgery. Okay, this one, the Elite Plus, will pay 3 times the benefit that Medicare pays or says is the right amount to pay for a surgery. Okay, so it's pretty substantial coverage, especially when you look at the fact that this plan is only $96 a month for a 35-year-old. That's a little different for everyone. But this is just an alternative option here, guys. And my point that I was trying to make is just that you can get health, dental, vision, and a critical illness plan and an accident plan, all for how much was it? Let's go back. Hold on. $189 a month. And that's just an example for somebody who's 35 years old. These plans do not actually have anything to do with your income. So it doesn't matter if you make a ton of money or a very little money. You can get these insurance plans also at any time of year. There's no open enrollment period. This is something you can sign up for at any time. I've also been told that the claim process is very easy with Manhattan Life. Basically, they give you an app, and if you go somewhere that doesn't want to take your insurance card, that's okay. You can go anywhere you want with this insurance. That's another thing. It's a PPO. So you don't have to worry about in-network or out-of-network. Anywhere you go, this insurance plan will pay. Okay? And if you go somewhere that doesn't want to take your insurance, you just take a picture of your visit receipt, and all of the the care codes that the doctor wrote up for you for everything they did, and you just upload it into the app, and then Manhattan Life will send you the money directly to your bank account or in the mail in a check. So there's a ton of different options out there for you if this type of insurance through the marketplace is becoming unaffordable. All that being said, if anybody needs any additional assistance, we can get something scheduled. Okay. But ultimately you should be able to, hopefully with this information I've given you, go in and update your application and pick a plan that works good for you from the individual marketplace. Anybody have any questions for me?
Yeah, this is David. I've got one question for you.
All right.
Yeah, on the income level for the health Sherpa, is that AGI or taxable?
Yes. I'm so sorry. I should have mentioned that. If you're self-employed, you need to use your adjusted gross income estimate.
Okay.
So whatever your income is after your expenses, the taxable income.
All right. That's what I was expecting. I just wanted to be sure.
If you're a W-2 employee, you just have to give them the total income. It's all taxable, basically. Anything else? No? Well, guys, like I said, if we need to, if I need to assist any of you one-on-one, we can set up an appointment. I'll go ahead and actually, what I can do is share my calendar link with you. So if you need to, you can set something up with me. But I've got to keep these meetings a little bit more brief because I've got so much going on. It's not even funny.
Victor, can I, because I came in kind of late.
Yeah, what's up?
So
How are you,
Kaylee
Deb?
said, hi, how are you? I'm good.
Good.
Kaylee said that we apply through the Sherpa. Is that how we're applying, or are we going into the market?
Yes,
Okay.
Health Sherpa. Yep.
Health-
And
okay.
if you've already got a Health Sherpa account, if you haven't been there in a while, all you need to do is use the email address that you have on file, that which you used when you applied, and
Okay.
select Forgot Password. And then when you reset your password, you can log right into Health Sherpa, and you can take a look at all of your details of everything you have currently. And then you're going to see a blue button, or it's going to be a button anyways, that says Renew.
Okay.
When you click that, it's going to just take you into update your application. If
Okay.
nothing's changed and all you're updating is your income, then you can just skip through all the way to the income, update your income, and then skip through all the way to the end. You've already done this several times, many years.
Yeah.
So it's no different really. Everything's just pretty much the same.
Okay.
The wording in some of the agreements might be a little different, but it's all pretty much still the same.
Okay. And then the
and
plans will pop up, or?
yeah, once you're done with your getting your official eligibility results, and really that's the best way to do it,
Okay.
because once you get your official eligibility results, then you'll know that everything you're looking at is exactly what you will pay. What I just showed you guys was a quote, which is always usually fairly accurate. But once you start going into the application and giving the real details and, being very specific, when you get to the end and you get your official eligibility results, those prices that you see on the plans are the exact price that you'll pay.
Okay. Thank you
Okay?
so much. Yeah.
Yeah.
Thank you.
You're welcome. And guys, I am doing these every week. I'm going to try to shoot for Wednesdays at 6. This is just my first one. I really appreciate you guys coming in. But I will be doing this next Wednesday at 6. And like I said, we can definitely try to do something one-on-one if you need a little assistance to get through. But yeah, just so you guys know, my main focus now, although I have many individual clients, my main focus is group insurance now. I've been handling a lot of big groups. I'm rebuilding my entire website, and I've got a bunch of paid ads campaigns going, and it's keeping me very busy. And I don't want to neglect my individual clients that have helped me get here. And that's why I'm doing these webinars and trying to stay open to one-on-one meetings if needed. Okay.
Did you send your meeting link? I don't know if I
No,
missed it or not.
I'm also not good at multitasking, so
I'm
just
going to
give me
use
a
it, but
sec.
I think I literally need like 5 minutes of your time.
Actually, you know what? I know what to do. It's even easier. Just go to my website, okay, victorinsuresyou.com, and like within 8 seconds, a pop-up will come up on the computer that says book a meeting, and that's my calendar link. Okay. So
Perfect.
I'll put my website in the link.
Appreciate it. Thanks for all your help today.
Yes, sir. Thank you so much, David, for coming. I look forward to hearing from you guys. Let me know if you need anything or have any questions. Okay.
Sounds good. Take care.
All right.
Thank you,
Alexandra,
Victor.
are you good? Yep. Are you good, Deb?
I'm good. Thank you.
All right. All right. Thanks, Deb. Talk to you soon.
Okay. Bye.
All right. Bye.